Hello and welcome. I want to share something with you today. Something that has been on my mind for a long time. It's a truth that often gets lost in the rush of modern medicine. We are taught to believe that more is always better when it comes to our health. More tests, more checkups, more information. But what if I told you that this isn't always the case? What if some of the very tests designed to protect us could actually be doing more harm than good? It's a shocking thought, I know. Let me pull back the curtain for a moment and share a perspective from the other side of the desk. Doctors, like all of us, want to do what is best. We are trained to find problems and to fix them. The fear of missing something, of not doing enough, is a powerful motivator in the medical world. This can lead to a culture of defensive medicine, where more tests are ordered just to be safe, to cover all the bases. Think of it like this. Every medical test, no matter how simple it seems, is a fork in the road. One path can lead to reassurance and life-saving treatment, but the other path can lead to a cascade of further interventions. The initial test might have been looking for a problem that was never going to cause harm, but the process of looking for it created a brand new one. A slow-growing cancer, for instance, might never cause any symptoms in our remaining lifetime. But the aggressive treatment for it, surgery, radiation, chemotherapy, could severely impact our quality of life today. The cure could be worse than the disease. We must start asking not just, can we test for this? But should we test for this? What will we do with the information? Will it truly help me live a better, happier life? My goal is to give you a framework for thinking, a set of questions to ask, and the confidence to advocate for a healthcare plan that honors your wisdom and your unique journey. But before we begin, I want to ask you to do something important. If you are tired of feeling like a passenger in your own life and are ready to take back control of your health, I urge you to subscribe to our channel. This is more than just a click of a button. It's a commitment to yourself. By subscribing, you will join a community of people just like you who are seeking a healthier, more vibrant future. Don't miss out on the life-changing advice we share every week. Click that subscribe button now, and let's begin this journey to a stronger you together. Let's begin with a test many of us are familiar with, one often hailed as the gold standard: the colonoscopy. For decades, we've been told regular colonoscopies, starting around age 50, are one of the most important things for long-term health. This procedure has saved countless lives by finding and removing precancerous polyps before they turn dangerous. But as we cross into our 70s and our 80s, the story begins to change. The math that once pointed so clearly toward routine screening can start to give a different answer. The preparation for the test is often the first hurdle. For an older adult, it can be much more challenging. It can lead to severe dehydration, electrolyte imbalances, and even kidney problems. The most serious is a perforation, a tear in the wall of the colon. A perforation is a medical emergency that usually requires major surgery and can lead to serious infections and a long recovery. Don't forget the risks from sedation or anesthesia, including confusion, breathing difficulties, and cardiovascular events like a heart attack or stroke. So, if a routine colonoscopy becomes riskier after 70, what is the alternative? One of the most sensible options is to transition to less invasive forms of screening. One of the best alternatives is a modern stool-based test, such as the outweigh. It is non-invasive, requires no special preparation or diet, and carries zero risk of complications from the test itself. Another important conversation to have with your doctor is about stopping screening altogether. Most expert panels recommend that routine screening for colorectal cancer can stop around age 75 for most people. Ultimately, the decision is deeply personal. It depends on your unique health profile, your life expectancy, and your personal values. Now we turn our attention to a test that has grown in popularity: the full-body scan. Often marketed directly to consumers with enticing promises of total health awareness. But what they often fail to mention is that virtually every major medical organization advises against these scans for healthy people without symptoms. The fundamental problem is that these scans are almost too good at what they do. They produce incredibly detailed images of our insides, showing every little bump, spot, and variation from the norm. These are normal signs of a life well lived. Wrinkles on the inside. This fishing expedition almost invariably leads to what we call incidentalomas. incidental findings that are unlikely to ever cause a problem. And the promised peace of mind instantly evaporates, replaced by a wave of anxiety and fear. This is the beginning of what doctors call a diagnostic cascade, or it might even lead to a needle biopsy, where a long needle is inserted through your chest wall to get a tissue sample. This period of uncertainty can be one of the most stressful experiences of a person's life. The initial scan didn't find a life-threatening disease. It created a patient out of a healthy person. A single full-body CT scan can expose a person to a dose of radiation roughly equivalent to 500 standard chest X-rays. Radiation effects are cumulative over a lifetime. Each dose adds to the next, slightly increasing the long-term risk of developing a radiation-induced cancer. Instead of a high-tech fishing expedition, focus on proven pillars of healthy aging. A balanced diet, regular physical activity, staying socially engaged, and making healthcare decisions based on sound medical evidence, not fear and marketing. Let's now turn to a topic that is of particular importance to men as they age: the prostate-specific antigen, or PSA test. This single number became a critical indicator, bringing either relief or profound worry. Prostate cancer can raise PSA, but so can many other things. The test is specific to the prostate, not cancer. A high PSA can create enormous anxiety, raising the specter of cancer. But often it's a false alarm. And often a prostate biopsy. It inserts a needle through the rectal wall into the prostate multiple times to collect tissue. Risks include pain, bleeding, and serious infection that can lead to hospitalization. The PSA test presents us with an even more profound dilemma: the problem of overdiagnosis, a cancer that a man would have died with, not from. Once the word cancer is spoken, it is almost impossible to ignore. The psychological pressure to do something is immense. Erectile dysfunction, urinary incontinence, bowel problems. The treatment becomes a disease in its own right. This is why major medical groups no longer recommend routine PSA screening for men over the age of 70. True wisdom lies not in finding every possible abnormality, but in protecting your present-day health and happiness from the unintended consequences of looking too hard. I'm talking about the routine checks for people taking blood thinners, particularly the older medication warfarin, also known as Coumadin. However, using these medications, especially warfarin, is like walking a tightrope. If the blood is too thick, the risk of a stroke is high. But if the blood becomes too thin, the risk of severe bleeding skyrockets. To manage this delicate balance, patients on warfarin must undergo frequent blood tests, often called INR checks. A change in diet, a new medication. Even a minor illness can throw the INR level off. This reactive seesaw approach, chasing after small fluctuations, can paradoxically lead to more time spent outside the safe therapeutic window. This frequent testing also creates a significant burden on the patient's life. Furthermore, the process of chasing the number can lead to what we call overcorrection. This instability can sometimes be more dangerous than allowing for small, stable variations. Fortunately, the world of blood thinners has evolved. The most important development has been direct oral anticoagulants, or DOACs. They offer a much more predictable and stable level of blood thinning, freeing patients from the relentless cycle of INR testing. This is a life-changing difference. It allows a person to simply take their medication and get on with living their life. If you or a loved one are over 70 and still taking warfarin, you can ask, would one of the newer blood thinners be a safer and better option for me? Our final discussion brings us to the topic of bone health. The primary tool used to assess this risk is the bone density scan. The result gives us a snapshot of our bone strength, a score that helps predict our risk of fracture. However, bone density is only one component of fracture risk. Other factors are just as, if not more, important. A person with a borderline T-score but excellent balance and strength may be at a lower risk of fracture than someone with a better bone density score who is frail and unsteady. The DEXA scan, however, compares your bone density to that of a healthy 30-year-old. By this standard, a huge percentage of older adults will be classified as having abnormal bones. The medications used to treat osteoporosis can be very effective, but they are not without risks. Some patients experience severe gastrointestinal side effects. More concerning, though rare, are serious complications. Shift focus from the bone number to practical fracture prevention. Work on balance and strength. Fall-proof your home. Review your medications. These interventions reduce falls, the main cause of fractures, and have no side effects, only benefits. We have journeyed together through some complex and deeply personal territory today. The wisdom to know your own body, to understand your priorities, and to advocate for a quality of life rich with joy and meaning. Become the chief executive of your own health journey. Ask, is this test truly necessary for me right now? Ask, what are the risks? Ask, will this course of action help me live a better life today? Medicine changes. Staying informed is your most powerful tool. What we shared today is just the beginning. Do not let this conversation end here. Click subscribe and join Wise Reflections. Subscribe now. Your health may depend on it.